First of all, I want to thank and all of the food assistance providers that are here today. The work you do is really, really important. And, the county was not much involved in food pre-pandemic. And so I would say, over all those years, we didn't have a real sense of the depth of the food needs in the community. And then when the pandemic hit, it was hard to disguise because people had were out of work, and it was harder to get to places and do things, and so the problem became more acute, and we wound up spending, I guess, up to $17 million a year on food. As the pandemic wound down, what most of our providers found was that the lines didn't wind down. So the hunger is still there. And as much as there are people who would like to pretend like the pandemic's over, we're back to the pre-pandemic. We may be back to the pre-pandemic, but we're back to the pre-pandemic that we never saw. And so the food needs are out there, and we need to continue to do that. We've put money back on our budget again to maintain a level of funding that we had previously. And obviously all this goes over to the council now. But we thought it was critically important to make sure that that you can put the food out and where you need to do it. I know the Food Council is working. There are going to be some changes in how we manage things, but I think the changes in managing things are going to be for the better. There will be more accountability now. In the middle of COVID, there was no way of setting up any kind of meaningful accountability process. I mean, people were coming every day and knocking on the door, and you couldn't say, wait till we get our administrative processes, wait, you'll eat more later, but you won't eat right now. So we couldn't do that, but we have the ability now to think about what we're doing and be more purposeful and intentional about it. And so I think that some of these changes are going to be really important, but I think at the end of the day, it'll help us preserve and be able to justify the work that we're doing. We lost over $7 million a month in SNAP benefits last year. And we have 150,000 county residents living below the self-sufficiency standard. So that's a lot of people who do not every day have the resources to be able to put food on the table and take care of themselves. And it's not the Montgomery County we like to think about, but it's the Montgomery County that is. And I'm a believer that our policies have to address the world that is, and not our imaginary view of ourselves or other people. And so we're going to continue to do this. In December 23, we were able to get $11 million additional in county dollars to close the gaps in federal resources. We've funded almost $2 million to over 30 organizations across 4 new grant programs in 2024, and we invested an additional $6.5 million for 70-plus food assistance providers, and we ensured our neighbors have access to nutritious and culturally diverse food. Our budget this year puts in $17 million again for funding these. It centers on equity, shifts power to residents with increased choice and retail buying access through MC Groceries, and new $1.8 million grocery delivery process. And so I actually like the evolution of this. I know more people are standing up things that look like stores so that people have the ability to choose what they're putting in their box rather than getting a pre-filled box. And I'd like to be able to do more of that, and I hope that that's, becomes the face of more of what we do, because it's good to give people some choice, and we have to be better about making sure we have the right supply of the right choices in there. But it's a good thing rather than just handing a box. I mean, there's a certain amount of dignity that comes out of being able to select things as opposed to just being given a box of food. And I think that, trying to preserve people's dignity is important for us to do. We also have to, address the root causes of hunger, and it's, comes down to wages and employment. And even though our minimum wage is $16.70, and on July 1, it'll climb somewhere north of $17, which is one of the highest minimum wages, probably one of the top 5 minimum wages in the country. It's still not enough. And I remember that, when we talked about the fight for 15, the fight for 15 was in 2015. That might have been the right wage then. It is not the right wage now. We should probably be in the low 20s at the very least. And my desire is to see if there's support on the council for dealing with an additional minimum wage bump, because the wage ought to enable a person to put a roof over their head and food on the table. And if you're working for somebody who doesn't pay you enough to do that, that's a real problem. And it's not fair for those companies to shift the burden of feeding and housing people onto the government. I mean, they're taking the profits they want. They should be able to make sure that the people who work for them and who make it possible for them to profit are able also to live a decent life. So I've been committed to that principle for a long time, and I hope we get to move more in that direction. We need to increase local food production, and we met the other day just with AfriThrive yesterday afternoon about another group that's trying to figure out how can we grow and how can we bring more food into the community. And unfortunately, they met with us at the end of the budget process, which is not the ideal time to have this discussion. But it's important that we be able to, over time, support more groups like that and make sure there's more local food. And we're going to try to maximize our private dollars through SNAP and state grants and grant-ready initiatives. And we need to keep asking the state for more support. I mean, they have larger pockets than we do. And obviously the federal government has the largest pockets, but the least responsible legislators. Hopefully the state is a group of people we can make more of an impression on about the need to continue to support that. We still have a strategic plan to end childhood hunger, and our strategies are intended to expand the reach to about 16,000 households, and future health challenges also help to reduce future health challenges amongst children and families. And we're actually working in that space. We've been working with our clinics and our hospitals and talking about how do we revamp our healthcare system. When you talk to the hospitals, they'll tell you they get patients too late in the process. They're often coming through the door when it's the door or they don't go to any doors anymore. And that's late in the healthcare process. And so we're working with the clinics and the hospitals about what we can do to have a more seamless system so that we're able to better take care of people at all stages, not just only at late stage. And I'm really encouraged the state legislature, thank you very much, for at least making people eligible for the healthcare programs in the state, because there are a lot of people who use our clinics who could get insurance, and that would help get the clinics full payment for their services. And one of the things we'll evaluate is the relative cost of whether, if we help people buy health insurance, is that less expensive than paying on the basis that we do now for the clinics. The clinics would still wind up getting funded, but they'd be getting funding based on insurance, and we'd like to have the most effective system. And I think anybody who deals in food knows that if the health issue is a big issue for people, and we need to figure out how we deal with it. When I taught school, I still remember kids coming to school totally beat tired in the morning because their parents took the whole family to the emergency room because they weren't going to leave little kids home alone while they had to take the sick child to the emergency room. So dependence on emergency rooms instead of preventive care and access to a regular doctor is a real problem for families. So we're going to continue to working with the Office of Food Systems Resiliency. We're going to continue to work with all of you as partners. She has a very healthy budget this year to begin this work with, and hopefully, as we make this, as we're successful, that we're able to make the case that if we need more food, we should get more food. This is not really something you should put an arbitrary limit on and say spend no more than X, because if the need is more than X and you know the need is more than X, how do you decide? I mean, it's like we're not all Solomons in this room, who gets and who doesn't get. That's not a position any of us should be in. So we should adjust our programs to what the needs are in the community, and hopefully we'll continue to do that. And as long as I'm county executive, we will always be working to guarantee that we can make it possible for you to help put food on the tables. I want to thank all of you for, another reason is, before COVID, almost everything flowed out of the government. We were far less dependent on community organizations. And during COVID, we had to shift because we realized we were not reaching the community at the depth that needed to be reached. We bought advertising, but the advertising didn't reach the communities that needed to be reached. And early on, we saw this disparity in, but first it was people who were getting tested for COVID, and then later it was people getting vaccinated for COVID. And so we put a shift in creating these hubs in the county. We didn't create the hubs created themselves. I've asked HHS since COVID ended to maintain the basic structure of the hubs and maintain the reliance on local community groups for doing this work, because you know the community better than we do. You know, you work with partners who have lived experience and who are embedded in these communities and can talk to people in ways the government simply doesn't do. It's not anybody's fault, but we just don't have the kind of roots to build the kind of trust that make it possible to learn and to communicate with people in a way that gets us all the information we need. So I'm glad to continue this partnership with all of you, because it worked during COVID. It kept people fed, it got people clothing, it did the things we wanted to do. We wouldn't have done it. Government was very good at handing out money. We don't print it, but we can write checks. So our ability to do that was really good, but your ability to do work that if all of you had fallen on us to provide the services you're providing, I don't know how we would have done it. We would have had to invent all new groups and all new systems to do what you all have done consistently from COVID to the present. So I'm really grateful for everything you've done in the past and grateful for the things I know you want to continue to do. Heather's going to be a great partner. She's been a great partner, and I want you to think of us as a resource. And if there are needs, let us know what the needs are. You can't fix something if nobody tells you. So it doesn't do any good to stew in your problems. If there are problems, we should at least know about it. May not always be able to fix them right away, but at least becomes a marker of something we need to address. So thank you all very much. I do appreciate everything you've done for us, and I'm very happy to see you all here today.